The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks from Go to Health Media. We're back with another great show. Did you know that 1 in 4 adults in the United States have some form of venous disease of the legs? We often think about heart disease and artery disease and avoiding those, but vein problems are much more common than artery disease. Vein problems can increase with age and can progress to the point of being disabling and should not be ignored. Vein problems can increase the risk for developing a blood clot or ulcer. Varicose veins, a symptom of vein disease, are not considered a cosmetic issue. They cause symptoms including heaviness or achiness in the legs, itchiness, discomfort, leg cramps, especially at night, and skin discoloration. What we're going to talk about today is the evaluation and treatment of vein-related disease. With us to talk about this is Dr. Thomas Doyle. Dr. Doyle has worked in vein and vascular medicine since 2005 and has performed well over 20,000 vascular procedures. He's also been a vein patient himself, so he can talk about that. And Dr. Doyle is certified by the American Board of Venous and Lymphatic Medicine. To show you more of who he is, Dr. Doyle has been board certified in emergency medicine since 1994 and impressively has participated in extensive medical relief missions in Louisiana and Mississippi after Hurricane Katrina and in Haiti after the 2010 earthquake. Dr. Thomas Doyle practices at Columbus Vascular Vein and Aesthetics in Westerville, Ohio, just outside of Columbus. You can reach him at the website CVVA.care. That's CVVA.care, which stands for Columbus Vein and Vascular Aesthetics. They're also on Facebook at Columbus Vein Aesthetics and Instagram at Columbus Vein Aesthetics. Welcome to the show, Doctor. How are you today?
I'm doing very well, thank you.
I wanted to get started. Are veins just a cosmetic issue? I mean, people have varicose veins and they think, okay, I've got varicose veins, but what do varicose veins really mean and how are they related to vein disease?
Sure, that's a terrific question. And vein medicine in general is one of the more under-recognized and undertreated aspects of healthcare in the United States. And it's for that very reason that people have often dismissed it as just a cosmetic issue or not recognized the types of symptoms and issues that can come from venous pathology. It's such a slow, gradually developing problem that people often think, well, that's just the way my legs are supposed to be. Even a lot of physicians, primary care doctors and such, will just attribute those symptoms to, oh, that's just cosmetic, or you just have to live with it. And neither of those are true. If I could, I'll start a little bit about how venous pathology works. If you think about it physiologically, blood comes down from the heart in the arteries, makes its way to the legs, gets used by the tissue, and then has to come back through the veins. As that blood comes back through the veins, if it's going through veins that have stretched out or now have developed some reflux, then the blood literally slows down. And as it slows down, it can promote the tissue to have a buildup of metabolites like lactic acid. The tissue can lose oxygen, and that can cause symptoms and problems in the long run. Also, that pressure can then cause veins to pop out on the surface, and that's where you get the cosmetic effects. People often notice spider veins, varicose veins that they see on the surface, but that's often just a harbinger or just a marker of pathology that's going on underneath that can really cause some problems.
What's the age of onset for this? I mean, I don't think young people get this. When does this kind of symptom come on?
It is a gradual and continual wear and tear due to gravity and fluid pressure, just like arthritis is wear and tear on bones.
Hmm.
Venous disease is wear and tear on the veins. Think about a balloon. If you take a balloon and blow it up too many times, it can lose its elasticity and become soft and floppy. That happens to certain veins in the legs just because of trying to fight against that backflow and pressure that gravity is putting on them. So, just like arthritis, almost everybody will develop some issues with veins over time due to that wear and tear. There are a lot of risk factors that can mean that some people will get it earlier than others, but I've treated people in their teens. It can come on very early in certain instances. There are certain risk factors. Pregnancy and hormones is one. That's why women tend to get them more than men, but we probably see about 35% men in our practice. And I actually have been a patient, so I can kind of vouch for that effect.
Yeah,
Um,
tell us a little bit about that, about being a vein patient. What was that like for you?
Sure, sure. Well, it's the type of thing that as I started out in the mid 2000s seeing vein patients, I was looking at their legs and then I was like, looking at my legs. And then I thought about it. I had a lot of symptoms, particularly night cramps, where I would jump out of bed in the middle of the night and my wife would look at me like I was crazy because my legs were cramping. And then I put two and two together, which up to that point, I mean, had already been a physician for quite a while at that point. I hadn't put the conclusion together that venous disease could cause those symptoms. So I had a procedure called an endovenous ablation, which is the type of procedure that we offer, among others. What it achieved was a great improvement in the symptoms that I had. My cramps went away about 80 to 90%. It was very successful.
Great. So you mentioned earlier that it shows up a little bit more in women than in men. Are there
Yes.
differences in ethnicity or race at all?
There really are not differences in ethnicity and race. The only difference might be in detection because a darker skin tone is somewhat harder to then see some of the superficial effects, such as spider veins and discoloration that can come from venous disease. So it might be under detected
Hmm.
in folks who have a darker skin tone, but it's the prevalence of the condition is the same across all demographics.
Got it. And what kind of symptoms are there that people should be noticing if there are vein issues that they're having? What symptoms would people have?
Sure. One of the first and most common ones that people will get is swelling. They'll just notice that their feet or their ankles swell a bit more, especially at the end of the day. Another would be if you notice veins that start to bulge on the surface, new spider veins that appear, or bulgy veins on the surface that can have a little bit of tenderness or occasionally an ache or discomfort to it. That's another one that comes on fairly early is fatigue or achiness. You just feel like your legs are really tired,
Mm.
especially by the end of the day. And then symptoms such as restless leg is a very common symptom that can be related to venous disease. And the principle behind that is as that spent or used blood is trying to make its way back from the legs through the veins that aren't doing a good job carrying it, the blood pools there. And so you get the urge literally to move your legs and flush that blood out. And so that sensation that you just want to kind of pump your calves and move your legs that comes with restless legs can fit quite nicely with the physiology behind venous insufficiency. And we do notice that patients who have it treated often notice quite a bit of improvement in their restless legs symptoms.
Is vein disease associated with any other conditions in the body, such as heart disease?
Not in a direct fashion. Arterial disease is more directly associated with cardiovascular issues, and that's primarily because you're looking at a blockage effect there. You're looking at accumulation of plaque or narrowing of arteries and trouble getting the blood flow in. And
Hmm.
that is a high priority issue.
Sure.
Obviously, if you don't get the blood there to begin with, then you're running into problems. But venous disease is more of a passive issue. It's the blood trying to get back. And so it's more dependent simply on factors such as genetic predisposition or time and wear and tear. If people stand a lot for their job, so teachers, postal workers, all kinds of folks who are in positions where they might be standing a lot, they often will get this more frequently than other folks. So it's not directly related so much to any other issues because it's more of a just fluid dynamics issue rather than a pathological process like development of plaque.
Got it. So vein health and vein disease are really something separate that you should be aware of. It's not connected with heart disease or anything else. It's really, you just got to be aware of what's going on with your legs.
Correct, absolutely. So patients who have heart disease might get it. Patients who don't have heart disease might get it. It's something that can affect literally everyone. And you had mentioned at the start that about a quarter of people will develop in their lifetimes. The number is probably much higher, probably half or more. It's still such a relatively under-recognized condition because people just think, well, that's my legs and I live with them.
Got it. So, in terms of healthcare, who picks up that I have vein disease? Does my general practitioner pick this up, or do I need to be referred to a vein specialist? How do I monitor the health of my veins?
Sure, it is something that can be picked up by specialists, such as a primary care doctor or a podiatrist or anyone who is taking a look at your feet and legs. They might see signs of it. But because they aren't necessarily focused on that issue, they might not make it a high priority. And that actually has been one of the things we've noticed historically is it is a somewhat under-recognized and therefore undertreated aspect of medicine. So sure, someone who's got it on their mind that they're looking for those signs may very well pick up on that. And we do get lots of referrals from primary care doctors or podiatrists or anyone who's taking a look at the lower extremities. So orthopedists sometimes can notice things like that. Dermatologists, because there can be significant skin changes that come from venous disease. So they very often will recognize that and send patients our way. But to be honest, it's something that people should be a bit more vigilant about themselves because it is so gradual and often isn't rising on the priority list of medical issues in people's minds. But if you think about it and you notice, well, hey, I am having some cramps or I am getting some restless legs and my legs do feel tired at the end of the day. My skin is changing a little bit. These are symptoms that you can pick up on yourself and then very easily just present to a vein clinic for evaluation and treatment.
Got it. Just because repeating things is beneficial for people retaining the information, tell me again, what are the symptoms that people should be looking for where there may be some indication of vein disease? What's a list
Sure.
of symptoms?
Mhm. So some of the most common indications to get a vein evaluation would be if you notice symptoms such as swelling, fatigue, cramps, heaviness in your legs. And then, of course, if you notice skin changes where your skin is looking a little discolored, especially down towards the ankles, if you notice big bulging veins on the surface or spider veins, that's another sign of it. Restless leg is a symptom that is very commonly associated with venous disease.
Mm-hmm.
Of course, this can progress if it's unchecked all the way to the point where you get poor wound healing. And so your skin can get breakdown or ulcers. Folks who have diabetes and are attributing some of their skin wounds to just diabetic ulcers may actually have a significant component of venous insufficiency that's contributing to them. So any type of skin change, wound, fatigue, pain, cramp, all of those would be an indication to at least check your vein function. It's very easy to do.
Great. And what's the difference between spider veins and varicose veins? Should I be worried about one more than the other, or are they the same thing?
They're basically manifestations of the same spectrum. A spider vein is just a very tiny vein or capillary that became stretched out over time due to that venous pressure and therefore shows up as those kind of branchy, spidery veins. They're technically varicose veins themselves as well, but the more classic definition of a varicose vein would be somewhat larger. So a little bit bigger, bulgy vein that's standing up out of the skin a bit. That's more classically called a varicose vein. But to be honest, it's the same pathological spectrum. Whether it was a tiny vein that got bigger or a somewhat bigger vein that got bigger, it's all the same process that makes the veins enlarge. It's that pressure and backflow that comes from insufficiency from some of the larger veins underneath that you don't even see.
So we've been talking with Dr. Thomas Doyle. He practices at Columbus Vascular Vein and Aesthetics in Westerville, Ohio, just outside of Columbus. The website is CVVA.care. That's CVVA.care. We will be back after this break with another segment with Dr. Doyle where we'll be talking about treatment for varicose veins or vein disease, what can be done about it, how you can possibly improve your situation either at home or preventive practices you can take at home to maintain your vein health. Stay with us. We'll be right back after this break. You are listening to Go to Health Media. To reach Jonathan Marks or his guest expert, You may send an email to jonathanmarks@go2healthmedia.com. You may also visit and subscribe to the website and show at go2healthmedia.com. And now, back to this week's show. Hey, welcome back. This is Jonathan Marks with Go to Health. We're talking today about veins and vein health and vein disease. We're talking with Dr. Thomas Doyle, who practices at Columbus Vascular Vein and Aesthetics in Westerville, Ohio, just outside of Columbus. His website is CVVA.care. That's CVVA.care. So, doctor, I wanted to talk about how can we at home be aware of our vein health and perhaps do things that will keep us healthier with our veins. What can we do at home to prevent vein disease?
Sure. A lot of these are simple common sense measures, things that you might even be doing naturally without linking it, being aware that it links to vein disease. So propping your legs up in the evening can sometimes help. And again, that's getting gravity to work in your favor rather than against you. Wearing compression socks, if they're comfortable for you to use, they often make your legs feel a lot better by the end of the day. And again, you're essentially giving that blood a boost to get up out of the legs and back to the heart and lungs for recirculation. So using compression socks whenever you're comfortable, that can be a helpful thing. Simple common sense measures also like exercising on a regular basis, the action of moving your legs. Walking is a terrific exercise for vein health because the pumping action of the calves helps to bring that blood back out and eliminate that pooling. Maintaining good, healthy weight, all of those things can be good promoters of good vein health.
Got it. So if I do need some kind of procedure, can you tell us about the different kinds of procedures that are done to improve vein health and get people out of trouble?
Absolutely. So the first thing we would ever do to evaluate a patient is a thorough diagnostic evaluation with an ultrasound study. The ultrasound will take a look at the veins and see which ones might have gone bad. And by that, I mean which ones have stretched out and are showing that backflow and reflux or poor valve function. And these are very numerical, direct, measurable things you can see on the ultrasound. And therefore, you can tell which veins really need treatment and which veins do not. If we do find that some of your veins need treatment, there is a spectrum of treatments that we can use to address that. The most thorough to take care of the larger veins that have the biggest reflux, we typically do a procedure called an ablation or endovenous ablation. Endovenous simply means you're getting on the inside of the vein. We use a type of catheter called a radiofrequency catheter that basically delivers heat to the inside of the lining of the vein and allows it to collapse. Historically, practices have used lasers and other types of treatment modalities to achieve that collapse of the vein. The most recent iteration of the technology is radiofrequency that is a bit gentler, gives good results, and a very quick recovery. Back when I had my veins done in the 2000s, we were using the laser technology at that point, and it worked fine, but the technology continues to improve over time. So the procedure we would do for those larger veins is called a radiofrequency ablation. It's a 15-minute procedure once we get you started. It's walk in, walk out, back to full level of activity right away. There's no downtime. The recovery is quick and easy. And the procedure itself is very straightforward. We access the vein, put a catheter on the inside of the vein, numb that catheter with some local anesthetic, run the catheter, and you're done. So patients find it very easy to go through. It's not utterly painless because there's some needle pinches, but they're pretty minor. So almost everyone comes through it very happy and thinking that it's not a big deal at all.
Is there general anesthesia or local anesthesia? How does that work?
It's all local anesthetic. So it's simply injections of a lidocaine mixture that numbs the skin and numbs the tissue around the vein. Each pinch that we would ever give you goes numb very rapidly. So the amount of discomfort is pretty minimal. I can vouch for that personally. Plus, literally every office I've ever worked in, once I get started there, almost everyone opts to have them done. So most of the staff in my current office has said, oh, wow, I should have this done too. And sure enough, went through the process. So that actually is very helpful as you explain things to patients, to be able to tell them, hey, I've had this done, or, you know, my nurse here has also had this done. So it's nice because you can empathize with what the patient experience is like. And it really is quite easy to go through.
Yeah. Explain to me the physiology, because this is just curious. I don't ever see any of my arteries on my skin, but I see lots of veins. What is it about the physiology of the vein that I'm seeing them? And can you see all the veins that are in trouble? Are they that close to the surface so that you know that they're in trouble? Uh, Tell me a little bit about that physiology.
Sure, that's a great question. A lot of the veins we would not be able to see directly on the surface, and we would need the ultrasound to find them. But veins tend to run closer to the surface than the arteries for a couple of reasons. Veins actually are one of the most important mechanisms for thermoregulation within the body. In other words, maintaining your own body temperature. So veins will dilate quite a bit if you need to radiate heat off. They'll constrict quite a bit if you're trying to preserve heat. And that's something you've probably noticed yourself, that your veins may constrict or a little bit more. Your extremities turn a little bluer when you're in the cold, or your skin can kind of dilate and the veins can be more prominent if you're hot and sweaty. So thermoregulation is a very important function of veins. Arteries tend to run a little deeper because they don't need to do the thermoregulation, and you kind of want to protect them from any potential damage, because if you cut an artery, they would be more aggressive at bleeding. So interesting reasons for why arteries run deep and why veins tend to run somewhat more superficial, although a lot of arteries and veins run in a paired fashion, especially once you get underneath the skin.
Tell us a little bit about your background. You were board certified in emergency medicine first, and then went into venous medicine. So tell us about that travel.
Absolutely. So I went to college at Princeton, I went to med school at Columbia University, and then did my residency in emergency medicine at Georgetown in DC, and practiced emergency medicine for a little over a decade before I started to also get interested in veins. I was recruited to work for a vein company because a lot of the procedures we do in the emergency department are related to emergency access of veins. So if you have a trauma patient, say, coming in and you suddenly need to get a big IV in them because you need to save their life, you can pull out the ultrasound, find a vein, and access the vein. So that's a skill set that emergency physicians often have. And so because I had that skill set, I was recruited to do the procedures for the vein company that I first started with. And that's really what most of the vein procedures boil down to, is using the ultrasound to find the vein, to access it, to then be able to get your procedure done.
How many procedures are you doing at CVVA, at Columbus Vascular Vein and Aesthetics? It sounds like a relatively simple procedure, so you must be doing a lot of them.
Yes, it is. It's a very simple, straightforward procedure. It does take about only 15 minutes or so to complete once we get you started.
Right.
So I do probably on the order of 30 to 40 patient procedures per week. You then do the math over the number of years that I've been doing it. It's well over 20,000, probably approaching 30,000 procedures that I've done in my career.
Got it. And tell us a little bit about what the experience is for the patient when I first start coming to you or start recognizing that I have vein problems. How soon am I getting this procedure done? Is this a short window, or is it kind of a longer window after some kind of evaluation? Tell us a little bit about that.
Sure. So there's always a diagnostic evaluation process. You need to find out what you're dealing with before you then come up with a treatment plan. But that's pretty quick. Typically, a patient will first come to us for an evaluation. We'll ask about their symptoms, see what physical findings we can see, and then recommend an ultrasound, which sometimes can even be done on the same day. Sometimes out of patient convenience, they'll schedule that a little bit later. But again, typically within a very short period of time, the patient will have their ultrasound evaluation. What the ultrasound tells us is very straightforward and in a numerical, measurable fashion which veins are bad. In other words, have they stretched out? Are they refluxing? Are they causing the problems that can trigger the symptoms? And if we find that certain veins are affected, then they become candidates for treatment. And it's very standardized across the nation, literally, which veins are bad and which veins are not. It all depends on how much they have stretched out and how long the blood is refluxing or going in the wrong direction. And these are things you see right on the ultrasound. So it takes away a lot of the guesswork to it. It's a very reproducible scientific approach to which veins actually are indicated for treatment and which veins are not. So Going by the adage, if it ain't broke, don't fix it. If there's a vein that's still functioning well, we leave that one alone. But if you do find that you have significant reflux in some of these veins, we say, okay, now here's our treatment plan for you. Typically, we will then move on to the actual treatment phase within a very short period of time. Within about 1 or 2 weeks is our typical time frame to then have a patient come in to have their first procedure.
Right. So it seems like it's a very simple procedure. It's a very simple diagnostic. It would seem then that the biggest barrier to vein health is actually patient recognition and perhaps talking about it with their doctor and then getting the doctor to refer to a vein specialist. Tell us a little bit more about that and how we can avoid or educate ourselves about being more aware of our vein health, because I'm sure most of us just kind of take it for granted and don't even think about it.
Yeah, that's exactly correct. Patients reproducibly will tell me, wow, I never realized that my legs felt so bad.
Right.
When they have the procedure done, then they say, wow, my legs just feel better. There's more spring in their step, more energy. They feel better. So a lot of times it's symptoms you have just gotten accustomed to over years and years that you don't realize they were there until they're gone. So yes, it is important to be cognizant of what features you might have yourself. So if you notice swelling, bulging veins, spider veins, and then the symptoms, cramps, fatigue, restless leg, even obscure things like itching and skin color changes can come from venous disease. So these are things that it would be important to recognize within yourself. Often other physicians may not be paying quite as much attention to it. And historically, it has been an under-recognized and undertreated aspect of medical care, quite literally because it is so slow in developing, and also because historically we couldn't do much about it. Go back about 15, 20 years, and the ultrasound technology was not there. So patients used to have to go through a procedure called a vein stripping, which was a significant surgical procedure where you would cut the vein out and you'd even be hospitalized for that.
Wow.
So because it was such a major thing to go through, people did not have it done unless it was really, really bad. So now that we have the ultrasound technology and the procedures are 15-minute office visits, it really makes sense to be a bit more on top of the condition before it gets worse.
Great. Good. So we've been talking with Dr. Thomas Doyle. He practices at Columbus Vascular Vein and Aesthetics in Westerville, Ohio, just outside of Columbus. His website is CVVA.care. And we've been talking about vein health, vein disease, and just now, all the vein procedures that can be done that are really very simple. It's a simple diagnostic and it's a simple procedure, so that it's really up to us and perhaps our doctors to recognize the importance of vein health and vein disease and how simple it can be to take care of it and improve our health. We'll be back after this break to talk more with Dr. Doyle and what we can do next to improve our vein health. Stay with us. We'll be right back. You are listening to Go to Health Media. To reach Jonathan Marks or his guest expert, you may send an email to jonathanmarks@gotohealthmedia.com. You may also visit and subscribe to the website and show at gotohealthmedia.com. And now, back to this week's show. Welcome back. This is Jonathan Marks with Go to Health, and today we're talking about vein health and vein disease. We're talking with Dr. Thomas Doyle, who practices at Columbus Vascular Vein and Aesthetics in Westerville, Ohio, just outside of Columbus. The website is CVVA.care. So, doctor, tell us, is there a sequence with which veins get treated or noticed, so that you treat certain veins first versus others? Tell us a little bit more about that process of total vein care.
We had talked earlier about how spider veins are actually a form of varicose vein. It's just a smaller vein that went bad. So veins come in a spectrum, and so our treatments also come in a spectrum of modalities we can use to address veins at each level of problem. So the primary treatment we would do for the largest veins would be the ablation procedure I talked about. But there are intermediate level treatments and fine-tuning treatments that we can do for veins that are somewhat smaller but still problematic. So large bulgy veins on the surface that might not be completely corrected by the ablation we can treat with a technique called ultrasound-guided sclerotherapy. Sclerotherapy is the injection of a solution into the vein to make it shrivel up chemically, as opposed to the RF catheter uses heat. So that's called a thermal ablation. Sclerotherapy is often called a chemical ablation. So it makes the vein shrivel up by inducing inflammation in the vein by using the chemical that makes it shrivel.
Mm-hmm.
So that sclerotherapy can be done at varying sizes of the vein and varying locations, depending on where we see them on the ultrasound or whether they simply are visible and bothering you on the surface. And so there's a lot of fine tuning we can do once we have initially developed the diagnosis and come up with a treatment plan for it.
Good. Now, you mentioned that a lot of doctors refer to your office, but if I'm a vein patient and I notice symptoms, can I come directly to your office, or do I need a referral?
No, you can come straight in. That's probably, if I had to guess, I'd say the majority of patients we get would come in on their own, notice their symptoms. They might have seen an advertisement or a word of mouth referral. So that's a large portion of our patients are actually not referred to us. We do get patients from doctors' offices who do pick up the conditions and the signs and send them over to us. But a lot of people are just out there picking it up themselves because, as I mentioned, it is a somewhat under-recognized condition. So please feel free to come on in if you notice anything that is potentially related to vein issue.
Good. So you're located just outside of Columbus. It's a community of Columbus, Ohio, and Westerville. What other communities do you serve?
Well, we serve the entire Columbus area, actually. We'll get patients coming to us an hour or 2 hours away. It just is a matter of convenience and access to the patient. So, yeah, we'll serve anyone from the entire greater Columbus area.
Great. And how big is your staff there? Are there other physicians who do this kind of work? Are you the sole guy? Tell us about that.
I'm the only physician. We do have a physician assistant who is excellent, and she will do a lot of the fine cosmetic work as well as some of the routine sclerotherapy cases. We have multiple medical assistants and ultrasound technologists and clinical staff. So we have a fairly large group of folks. We work very well together, and we're able to see quite a few patients.
Great. And when you say fine cosmetic work, tell me what you mean by that.
So once you get to the tiniest spider veins, a lot of times insurance companies will no longer recognize that aspect as being medically necessary because they're not as likely to be associated with symptoms. Often we can get quite a bit of cosmetic improvement as well as therapeutic improvement by addressing the veins with the ablations and the ultrasound-guided sclerotherapy, and the procedures we do in order to eliminate the symptoms also will have cosmetic benefit. But once you've hit that last stage where there's just some fine tuning left of some unsightly spider veins on the skin, that type of thing, then that becomes more of an aesthetic issue. And our nurse practitioner, Kayla Reiser, is excellent. She does great work with the tiny veins that often can complete what the patient wants. But patients often come in wanting both significant symptomatic relief and cosmetic improvement. And the treatments do deliver both.
Great. And what kind of insurance do you take?
We take almost every commercial insurance. We take Medicare, we take Medicaid. I think there's one or two insurance plans out there that don't have us in network, but for the most part, we take almost every insurance.
That's great to hear. So there shouldn't be any boundaries or problems in coming to see you because your insurance will be covered. Great. So we've been talking with Dr. Thomas Doyle. He practices at Columbus Vascular Vein and Aesthetics in Westerville, Ohio, just outside of Columbus. The website is CVVA.care. Thanks so much for being with us today, Dr. Doyle. It's really great to learn about veins, the importance of maintaining vein health, and the simplicity with which your veins can be treated if you have some kind of problem.
Yeah, absolutely. It's been my pleasure.
Thanks, everybody, for watching. And again, as we always say at the end of every show, go to health. Take care. We'll see you again next time. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.